طبعا في البداية راح ناخذ introduction بسيطة عن most common and important hormones in our body. طبعا نعرف انه الهايبوثالاموس affecting on طبعا with hypothalamic hormones on the pituitary gland. Pituitary gland به anterior و posterior. الانتيريور secreted growth hormone, prolactin, LH, FSH, act hormone and TSH. والposterior pituitary تفرز من الفازوبروسين ADH and oxytocin. طبعا راح ناخذ most common and important hormonal disorder in pediatric اللي تشملنا بالبداية وراح ناخذها هي الهايبوثايرودزم أو الثايرويد جلاند abnormality. راح ناخذ بهالمحاضرة etiology, clinical feature, investigation, treatment, complication of both hypo and hyperthyroidism. hypothyroidism أو الكريتينيزم. Thyroid stimulating hormone, also known as thyrotropin, thyrotropic hormone أو يعني نختصرها بال TSH. It is a pituitary hormone that stimulates the thyroid gland to produce thyroxine, and thyroxine convert to triiodothyronine, which stimulates the metabolism of almost every tissue in the body. نختصر الثايروكسين أو نختصر الثايرويد هرمون بأنه هو الفيول أوف ذا بودي، يعني الفيول أوف ذا بودي هو بنزين الجسم. من نفتهم هذا الشيء راح نعرف بالمختصر ليش راح يصير عندنا السيمتوم أوف هايبوثايرودزم أو السيمتوم أوف هايبرثايرودزم، إن زاد الفيول أو قل الفيول. شايفين هذا المخطط كلكم hypothalamic affecting pituitary تنطينا TSH stimulate T3 T4 secretion. طبعا بالمختصر كذلك همات pituitary gland affecting thyroid hormone affecting growth, development and increase catecholamine effect. زين. etiology. راح ناخذ congenital hypothyroidism لأنه most important and most common. It is common and serious disease. Its prevalence in about 1 over 4,000 infants. وبالجديد همات يقولون 1 over 3,600. يعني common. Congenital hypothyroidism is either primary, which is the most common cause due to defect in the thyroid gland itself, or thyroid hormone receptor, or central, يعني hypopituitarism due to TSH or TRH deficiency or irresponsiveness. ممكن primary أو ممكن secondary أو يسموه central اللي هو due to hypothalamic or pituitary disorder. Thyroid dysgenesis. It is the most common cause of congenital hypothyroidism. About 85% of congenital hypothyroidism is due to thyroid dysgenesis. It affects female أكثر من الميل. طبعا هو بصورة عامة كل thyroid disorder هي affecting الفيميل أكثر من الميل سواء congenital or acquired. It includes aplasia, hypoplasia or ectopic gland اللي هي طبعا most common, which is either lingual or sublingual or subhyoid and can cause thyroglossal duct cyst. It can be detected on thyroid scan or ultrasound. Defective thyroxine synthesis or dyshormonogenesis. It is autosomal recessive with goiter always present. When the defect is incomplete, the onset of hypothyroidism may be delayed for years. يعني حقيقة مو شرط هذا التايب affecting neonate. The symptom may delay for many years. Third cause, defect in iodide transport. It is rare due to mutation in the sodium iodide transporter and involve both thyroid and salivary gland. Diagnosis by decreased reuptake of radioiodide, but can be treated by large doses of potassium iodide or better by thyroxine. عندنا فد entity خاص يسموه hypothyroidism in preterm infant. حقيقة هو المشكلة مو بالكواليتي، هي نفس الeffectiveness of thyroid hormone، لكن المشكلة وين بالكوانتيتي. الكوانتيتي of thyroid hormones تكون قليلة. ليش؟ احنا عندنا بريتيرم، البريتيرم راح loss of transmaternal thyroid hormone. بالإضافة إلى لأنه هو premature فعندنا الهايبوثالاميك pituitary thyroid axis بعد immature، ولذلك إيش راح يصير؟ راح يصير عندنا شغلتين: loss of maternal contribution of thyroid hormone، loss of stimulation of thyroid hormone، ولذلك إيش راح يصير؟ راح يصير عندي TSH and T4 السيرج reduced، although طبعا كان يصير free T4 normal لكنه total T4 هو decrease which remain decreased and the deficiency also يعني increase with time if there is complication like RDS. طبعا حتى هو الهايبوثايرودزم in preterm baby يعني يعني should be treated with thyroxine for يعني for weeks يعني مو ولا for long time، مو مثل congenital. clinical feature طبعا أكيد إحنا قلنا إنه ماكو energy ماكو fuel decrease metabolism of the body. فإيش راح يصير عندنا؟ راح يصير عندنا إنه most infants with congenital hypothyroidism are asymptomatic at birth. ليش؟ because of the effect of transmaternal thyroid hormone طبعا which is affecting temporarily. من يروح transmaternal أو transplacental T4 راح تبدي عندنا السيمتوم of hypothyroidism. thus early diagnosis is depend on neonatal screen. يعني هو ممكن عنده hypothyroidism ولكن يعني ما تبين عنده symptom، لذلك كلش ضروري neonatal screening test. otherwise physician must always have high index of suspicion about early manifestation of congenital hypothyroidism. يعني مثل هالبيبي ببساطة اللي عنده يصير generalized edema، large tongue، dried skin، umbilical hernia، prolonged jaundice. طبعا البيبي يجي حتى يجي quiet baby، الأم يعني تقول حباب، هو الكرايم قليل، الاكتيفيتي مالته قليل 24 ساعة يعني هادئ وساكت ونايم. ف lethargy، hoarseness of the voice وغيرها. هاي قلناها lethargy، sleeping، poor hoarse cry، poor appetite، feeding، apnea، noise respiration. طبعا constipation أكيد لأنه كل الميتابوليزم هي قليلة، في الميتابوليزم of the intestine قليلة so constipation. laryngeal edema فيصيرون hoarse voice، prolonged jaundice لأنه delay maturation of glucuronide conjugation etc. examination. Dysmorphic feature include open mouth، large protruded tongue، hyperthyroidism، depressed nasal bridge، short and thick neck, and fontanelle are widely opened. Other features include birth weight and length are normal, head size is normal or slightly increased, hypothermia, temperature may be less than 35 centigrade, bradycardia with or without heart murmur, abdominal distension, umbilical hernia, cold mottled skin which is yellow in color. طبعا هو ممكن due to jaundice or maybe due to carotenemia in addition to jaundice. myxedema, hypotonia, later on delay indentation. لذلك أي baby delay dentation should be excluded. vitamin D deficiency, familiar and hypothyroidism. Congenital hypothyroidism may be associated with other conditions like sensorineural defects 20% or congenital heart disease in 10%. صورة بسيطة عن congenital hypothyroidism: protruded tongue, growth retardation, abdominal distension, umbilical hernia, yellowish discoloration of skin, dry skin, slow reflexes or delay reflexes can lead to جعفر خلي أجل الأسئلة ورا المحاضرة مو أحسن؟ طبعا هو لا يعني أبنية، لكن هي بس هذا الأدمة اللي يسوي لنا hoarseness، فد little bit of أدمة يعني مو فد severe أدمة اللي يسوي لنا شو اسمه اللي يسوي لنا، لكنه بس يسوي لنا hoarseness of the voice. طبعا لأنه مس symmetrical أدمة عادة، وممكن مثلا يجون بسترايدر أهل الكونجنتال، بس هذا طبعا كلش رير. احنا نحكي عنه presentation يعني. investigation neonatal screen is a mandatory. قبل كان لا، يعني انه اعتمادا على السيمتوم يدزون investigation او thyroid function test. لكن حاليا يعني today neonatal screen is a mandatory. زين اللي يشمل screening test for thyroid abnormality and other يعني most common congenital or metabolic disorder. It depends on measuring serum T4. طبعا normal value should be يعني remembered لازم تحفظوها 6 to 22 microgram per deciliter. If low, measure TSH. If high, more than 100 microunit per liter, this will confirm primary hypothyroidism. Serum T3 maybe normal, لكن نعتمد عليه على T4 وال TSH. Be careful during screening of identical twins who share one placenta because T4 may transfer from euthyroid infant to other hypothyroid one. لذلك ممكن حتى إذا كان normal يعني the test should be repeated after 2 to 4 weeks. CBC usually show macrocytic anemia, which is usually refractory to treatment with hematinic. X-ray of the knee show absence of distal femoral epiphysis in about 60% of cases, which normally should be present at birth. Epiphyseal dysgenesis usually occur later on. The X-ray cheaper available كcost effect لكنه يعني sensitivity مالته 60% يعني يعتبرها قليل. Skull X-ray should show large fontanelle, white suture, Hormone bone, and a large lithotrachea. Chest X-ray show cardiomegaly with or without pericardial effusion. Ultrasound of the neck should can be detected the size and the size of thyroid gland. هذه الإكس-راي knee X-ray show absence of distal femoral epiphysis of neonate with hypothyroidism. Skull X-ray show wide suture and Hormone bone. طبعا wide anterior fontanelle vein. Thyroid scan with radioiodide will reveal its uptake if there is any normal thyroid tissue, whereas failure of radioiodine uptake suggests either thyroid aplasia, iodide trapping defect, or neonatal with a thyrotropin receptor blocker antibody. Thyroglobulin level, its decrease in thyroid aplasia or defect in its synthesis, but an increase in ectopic gland or and goiter. موجودة الجلاند لذلك thyroglobulin increase. Serum cholesterol level usually elevated in children more than 2 years of age. ECG and EEG both show low voltage. MRI is normal in primary hypothyroidism, but may be abnormal in central hypothyroidism due to pituitary abnormality. Treatment. Levothyroxine T4 is given orally. Levothyroxine هو the drug of choice it is يعني mandatory obligatory شو تسموه treatment in patient with congenital hypothyroidism. نبدي طبعا هاي دوز. ليش؟ لأنه احنا بالبداية بالنيونيت نحتاج high dose to catch up the growth and metabolism of the brain. نبدي 10 to 15 microgram per kg per day for neonate and infant. طبعا المقصود بالinfant انه first 2 years لأنه brain development mostly 95 of brain development finished or complete in the first 2 years. Whereas children more than 3 years راح نبدي يعني نقلل الدوز توصل إلى 4 microgram per kg per day. واللي يسأل ليش؟ لأنه إحنا عادة نحتاج الميتابوليزم of the brain. إحنا عادة بعد ما يكون البرين well developed finished the growth يعني راح نحتاج بالordinary dose for the daily activity. A good index of adequacy of treatment is growth rate and change in behavior and activity. يعني إحنا بنحط patient على thyroid hormones. أكو patient مثل ما يقدر يسوي لك follow up إنه كل 2 months تعيد له TSH T4. تقدر بس إذا صعب عليك الفولو اب هرمونالي ممكن لا يعني growth rate and change. ليش؟ لأنه أنت بالgrowth rate راح تعرف راح يشوف إذا catch up the growth with the normal lines أو normal percentile معناها it's okay يعني your dose is okay and there is no need for tapering or decrease. Side effect of thyroxine especially in overdose the same of hyperthyroidism اللي هي craniosynostosis, compartment problem, pseudotumor cerebri طبعا in older children in cross-spontaneous. Oral thyroxine should not be mixed with iron, calcium or soy protein formula. لذلك دائما نقول لهم انه ننطي الثايروكسين 2 hour before 2 hour after feeding يعني على empty stomach لانه من نسوي mixing with calcium, soy protein or iron may change the thyroxine metabolism فما راح يوصل بالدوز الصحيحة. The goal of replacement treatment is to bring level of T4 and TSH to normal range which require frequent monitoring at interval. بالبداية أول طبعا الفولو أب راح يكون أول 6 months monthly بعدين every 2 to 3 months till 2 years of age then 6 months then every 6 months after 2 years. Complication. Congenital hypothyroidism if any treated in the first 3 to 6 months of life will severely affecting physical and mental development which lead to delay milestone, stunted growth, and delay sexual maturation. Prognosis. Early diagnosis, early replacement of treatment reveal excellent prognosis. Thyroid hormones are very essential for brain development in the early postnatal month. Thus, early diagnosis and treatment is critical to prevent progressive psychological sickness. If the onset of hypothyroidism occur after 2 years of age, there may be no development, even if the diagnosis and treatment delay. نجي للacquired hypothyroidism. شباب بس خلوا الموبايلات الموجود مالاتكم. May present in child. Typical features include dry skin, constipation, hair loss, fatigue, cold intolerance, apathy, rest or delayed relaxation phase of the tender reflexes, and weakness. A sharp deceleration in the growth may also be seen in children with acquired hypothyroidism, as seen in stroke care. شوفوا هذا نفس البيبي هذا كان healthy والأكتي ما عنده بعدين صار هاشيموتو ثايرويدايتس بعدين after replacement of treatment. إذا تشوفون الجروث of him بالبداية normal growth بدأ شوية يقل إلى بعدين صار stunted صار flat ماكو أي growth زين بداية الأونست of symptoms. بعدين من بدينا التريتمنت بالثايروكسين the baby catch up the growth زاد الجروث مالته. Family history is often positive for autoimmune thyroid disease. The diagnosis is confirmed by measuring of high TSH level and low thyroxine level. يعني antibody that directed against thyroid peroxidase and thyroglobulin اللي هو طبعا نسميه peroxidase antibody may be present or even elevated are often detected after institution of thyroid hormones replacement therapy. Growth velocity return to normal مثل ما شفنا قبل شوي. حتى لا تخترعون هاي النظرات مرة ننساها. هذه طبعا احنا الهايبوثايرويدزم خلصناهم. هذا البيبي turning to you with hyperthyroidism with congenital hypothyroidism هي opposite of hypothyroidism. زين حتى خاف أكو واحد مثلا نعس أو نايم هي الصورة الصحية. Congenital hyperthyroidism is occur in only 2% of infants born to mother with history of grave disease due to transplacental passage of thyrotropin receptor stimulating antibody. but the clinical onset and severity and the course may be modified by the concurrent presence of thyrotropin receptor blocker antibody. معنى mother عندها grave disease وتاخذ anti thyroid وعلى anti thyroid drug، لكن اكو عندنا صار transplacental passage of thyrotropin receptor stimulating antibody. هذا الانتيبودي او الثايروتروبين ريسبتور stimulating antibody راح يعبر transplacental to the baby ويسوي لنا congenital hyperthyroidism، لكن only 2% from the baby will develop severe symptom. ليش؟ لأنه أكو عندنا modified thyrotropin receptor blocker antibody، لذلك يسوي لنا equalization. This antibody may delay symptom for several weeks after birth, and by transplacental passage of antithyroid drug taken by the mother may also delay symptom. يعني ممكن thyrotropin blocking antibody وممكن لا، لأنه المذر تاخذ antithyroid يعبر through the breast milk أو through the placenta by 3 to 4 days. This order usually remits spontaneously within 6 to 12 weeks, but can persist longer depending on the level of thyrotropin receptor stimulating antibody. هي عادة transient disease. Clinical manifestation: prenatal diagnosis by fetal ultrasound can detect fetal tachycardia and goiter. Many of infants are premature with IUGR. Most have goiter. The infant is extremely listless, irritable, and hyperactive, and appear anxious and unusually alert. The eyes are open widely مثل ما شفتوا بالصورة and appear exophthalmic. There may be extreme tachycardia and tachypnea, and the temperature is elevated. In severely affected infant, there is weight loss despite vigorous appetite, hepatosplenomegaly, jaundice, hypertension, and heart failure. The infant can die if therapy is not instituted promptly. Persistent hyperthyroidism leads to advanced bone age, frontal bruising, craniosynostosis, microcephaly, and cognitive impairment when treatment is delayed. Investigation: serum level of T4 or free T4 and T3 are markedly elevated. TSH is suppressed. Oral propranolol or Injiral dose مالته 1 to 2 mg per kg per day divided by 3, and methimazole اللي هو الانتي-thyroid drug 0.25 to 1 mg per kg per day every 12 hours. Saturated solution of potassium iodide 1 drop per day may be added. If the thyrotoxic state is severe, IV fluid therapy and corticosteroid may be indicated. يعني نعملها معاملة الثايرويد storm. If heart failure occurs, digitalization is indicated. After euthyroid state is reached, antithyroid medication, methimazole, should be gradually tapered. Most cases remit by 3 to 4 months of age. Prognosis: rarely, classical neonatal grave disease does not remit but persist for several years or longer. دول عادة عندهم impressive positive family history of grave disease. Conversely, sometimes in utero hyperthyroidism appear to suppress the hypothalamic pituitary thyroid feedback mechanism, lead to permanent central hypothyroidism, require lifelong thyroid hormone treatment. Oh, thank you.